Gentlemen, let's say it out loud because nobody else will. A lot of men quietly wonder the same thing when weeks turn into months and months turn into, I can't even remember the last time. Did I break something? Did my body forget how? Is it going to be different forever? And the worst part is, the internet gives you two equally useless answers. Nothing matters. Don't worry about it. Use it or lose it. Your body will shut down. Both are missing the truth. Here's the real deal. Your body doesn't punish you for being human, for being single, stressed, sick, grieving, or simply in a season where intimacy isn't happening. But your body does adapt to patterns, just like it adapts to a sedentary lifestyle, poor sleep, or chronic stress. So in this video, we're going to separate myths from reality, explain what changes can happen when you go a long time without sex, and, most importantly, give you a simple plan to protect your sexual health, even if your relationship status is complicated. Stay to the end, because I'm also going to share the few warning signs that are not normal, and what they can be trying to tell you about your heart, your hormones, or your mental health. Myth number 1. If I don't use it, it stops working completely. No, your body is not a light switch. Sexual function relies on tissues, nerves, blood vessels, and brain chemistry. Those systems don't just vanish because you took a break. In most men, function can return, sometimes quickly once the right conditions come back. Better sleep, lower stress, improved fitness, medical support, or renewed intimacy. But I want to be honest. While you can't lose it overnight, you can slowly lose conditioning. Like a guy who used to run 5K and then stops for a year. He can still run, but the first run back might feel rough. That's the better way to understand it. Not lose it, but detune it. Myth number 2. If I go without sex long enough, my libido is gone forever. Also, no. Libido is not just testosterone. Libido is a team sport. Sleep, stress levels, mental health, relationship dynamics, body image, medications, alcohol, physical conditioning, and yes, hormones. When any of those factors shift, desire can drop. And when those factors improve, desire often returns. So the question isn't, did I permanently lose desire? The better question is, what's influencing my desire right now? And what can I control? Instead of thinking about sex as a single ability, I want you to think about it as 4 connected systems: blood flow and vessel health, tissue flexibility and responsiveness, pelvic floor strength and coordination, the brain, stress, confidence, mood, connection. And hovering above all of that is your internal climate control, hormones, especially testosterone. When sex is regular, whether partnered or solo, these systems get frequent practice. When sex disappears for a long time, your body doesn't collapse, but it may become a little less responsive, especially if you're also dealing with aging, high blood pressure, diabetes, extra weight, or poor sleep. Now let's walk through what changes actually tend to show up, and what's usually reversible. Here's a blunt truth many men don't hear early enough. Erections are a blood flow event. That's not poetry. That's physiology. When you're aroused, blood moves into the erectile tissue. That pressure is what creates firmness. So anything that harms blood flow, smoking, uncontrolled blood pressure, diabetes, sedentary living, poor sleep, can show up as weaker erections long before you notice other symptoms. Now, what does that have to do with going without sex? Even without sex, the body often provides maintenance through nighttime erections. Most men have them during certain sleep stages. They help keep tissue oxygenated and responsive. But if you go long stretches without arousal and without strong nighttime erections, especially if your sleep quality is poor, some men notice a pattern. It takes longer to get going. The first few erections back feel softer. The response feels delayed. That doesn't automatically mean you're broken. It may mean Your system is a bit out of practice, or your sleep and circulation are dragging. A lot of guys misinterpret the first off experience as a permanent diagnosis, and that panic becomes the real problem. Panic triggers adrenaline. Adrenaline is basically the anti-erection hormone because it shifts your body into fight or flight mode. Your blood vessels tighten, your mind races, your body chooses survival over sex. So if you've been inactive for a long time and the first time back feels different, the worst move is to treat that one moment like a verdict on your future. Treat it like a warm-up, not a final exam. Practical takeaway: the easiest way to support erection quality, whether you're sexually active or not, is to support the thing erections depend on. Daily walking, cardio conditioning, strength training, better sleep, managing blood pressure and blood sugar. And yes, I'm going to say something unpopular. If your lifestyle is quietly wrecking your circulation, more sex won't fix the root cause. It may expose the issue, but the solution is upstream. Think of erectile tissue like an elastic structure that performs best when it's regularly supplied and used. When arousal happens, tissues expand and relax. When orgasm happens, muscles contract rhythmically. When this cycle is absent for long periods, some men describe feeling stiffer initially, needing more stimulation than before, feeling less immediate sensitivity, noticing a slower ramp-up. Again, I'm not describing doom. I'm describing adaptation. My commentary: you know what else affects sensitivity and response that almost nobody talks about? Stress and emotional numbness, depression, overstimulation from porn for some men, alcohol, certain medications, especially some antidepressants. So if your function feels different after a long dry spell, don't assume the dry spell is the only variable. Many men had a silent pileup of factors at the same time. Less sleep, more anxiety, more drinking, less exercise, more loneliness. And the body reflects the full picture. What helps? Rebuilding physical conditioning, lowering stress levels, better sleep hygiene. If you choose solo activity, being mindful about it, not compulsive, not shame-driven. Talking to a clinician if medications might be contributing. Let's talk about a part of male health that's weirdly ignored until it becomes a problem: your pelvic floor. These are muscles that support the bladder and contribute to erection quality and orgasm intensity. During orgasm, the pelvic floor contracts rhythmically. That's not just pleasure, it's neuromuscular activity. So when sexual activity stops, you remove one of the natural training patterns those muscles get. Some men notice subtle changes, such as slightly more urgency, feeling less control, occasional leakage when coughing/laughing, more common with age or after prostate issues. Now, I want to be careful here. Not being sexually active doesn't automatically cause urinary problems, but if pelvic floor tone is already borderline, the lack of regular contraction can reveal it. The pelvic floor isn't only about strength, it's also about coordination. Some men overdo Kegels and create too much tension, which can backfire. Tight muscles can contribute to discomfort, urgency, or even sexual issues. So the goal is balanced function, strength, and relaxation. A simple pelvic routine, non-medical, general wellness. Gentle pelvic contractions, squeeze as if stopping urine. Hold 2 to 3 seconds. Relax fully. Repeat 10 times. Do 2 to 3 sets per day. If you feel pain, stop and ask a professional. Pelvic PT can be life-changing. And if you're thinking, this sounds too small to matter, remember, tiny daily inputs create major long-term outcomes. Testosterone naturally tends to decline with age. But here's what many men miss. Even when labs are normal, men can experience changes in motivation, energy, mood, confidence, desire, especially if sleep is poor and stress is high. Now, does not having sex automatically crash testosterone? Not necessarily. The relationship is complicated, but what does happen is something more behavioral and psychological. When you go a long time without sex, your brain can downshift from seeking connection to avoiding disappointment. Desire becomes risky. Desire creates hope. Hope creates the possibility of rejection, performance anxiety, or emotional pain. So the mind protects you by lowering the signal. That's why some men don't just lose sex. They lose the idea of sex. They stop flirting. They stop imagining. They stop feeling present. This is one of the most important sections of the video because it's where men often mislabel emotional protection as, my body is failing. Sometimes the body isn't failing. Sometimes the body is responding to loneliness, grief, conflict with a partner, resentment, fear of not measuring up, chronic porn-driven comparison, past embarrassment. So as libido is low, don't only ask, what's my testosterone? Also ask, what's my emotional environment? If you have persistent low libido, lower energy, depressed mood, reduced strength, and overall flatness, it's reasonable to talk to a clinician about checking testosterone, especially if you're over 40 or have metabolic risk factors. But be smart. Hormones are not a shortcut for sleep, fitness, and mental health. They're a tool, sometimes appropriate, sometimes not. If you remember one thing from this whole video, let it be this. For many men, the hardest consequences of not having sex are not physical. They're psychological. Men report higher stress, worse sleep, more irritability, more loneliness, less confidence, feeling older or less alive. And if you're in a relationship, the absence of physical intimacy can create a quiet emotional gap. Not always, but often, because sex isn't only a release. It's also reassurance. You still want me. We're still connected. I still matter. Here's a strong opinion. Society often teaches men that if they want intimacy, they're weak, needy, or only after one thing. That's nonsense. Wanting connection is human, and pretending you did doesn't make you strong. It just makes you isolated. Now, that doesn't mean you should chase sex at any cost. It means you should build a life that supports intimacy, friendships, fitness, purpose, emotional regulation, communication skills, mental health support when needed, because the most underrated libido booster is not a supplement. It's a life that doesn't exhaust you. Let's turn all of this into action. Here are 4 categories that protect sexual function, even if you're not currently having sex. 1. Protect your blood vessels. Walk daily, even 20 to 30 minutes matters. Do cardio 2 to 4 times per week. Strength train 2 to 3 times per week. Manage blood pressure, blood sugar, and waist circumference. You can't talk your way out of biology. Erections follow circulation. 2. Train the pelvic floor properly. Basic pelvic contractions plus full relaxation. Consistency beats intensity. If you have pain, urgency issues, or post-prostate symptoms, consider a pelvic floor specialist. 3. Maintain sexual function without shame. Optional but valid. If you're single or your relationship has limits right now, solo sexual activity can be a normal part of maintaining function. Blood flow, neuromuscular patterning, and confidence. But I'll add a nuance. It matters how you do it. If it's rushed, secretive, shameful, or compulsive, it may increase anxiety. If it's mindful, not excessive, and not linked to self-disgust, it can be supportive. Get the right medical support when needed. This is the part men avoid because pride gets in the way. If you have persistent erectile dysfunction, don't just assume it's aging. Sometimes it's your early warning sign. And if you have diabetes, Cardiovascular disease, sleep apnea symptoms, loud snoring, daytime exhaustion, depression, medication side effects, then ignoring sexual symptoms is like ignoring the check engine light. Most changes after a dry spell are reversible, but a few situations deserve real attention. Sudden, complete inability to get erections that persists, pain with erections or ejaculation, blood and urine or severe urinary pain urgency, major fatigue, depression, or mood collapse that interferes with daily life. ED plus chest pain, shortness of breath, or exercise intolerance. Get evaluated. These aren't moral failures. They're health signals. I want to close with something that hits harder than physiology. Many men tie their identity to sexual performance, not because they're shallow, because they were taught that's what makes them valuable. So when sex disappears, whether due to divorce, illness, rejection, grief, or a dead bedroom, it doesn't just feel like missing pleasure. It can feel like losing your place in the world. If that's you, hear this clearly. Your worth is not measured by frequency. Your masculinity is not measured by performance. And your future is not defined by one rough moment after a long break. Your body is adaptable. Your nervous system can retrain. Your health can improve. And you can rebuild. Slowly, realistically, without panic. So, do you use it or lose it? Not in the catastrophic way people fear. What's true is simpler and more empowering. Your body responds to how you live. Support your circulation, your sleep, your strength, your stress levels, and your connection. And your sexual health usually follows. If you want, in the next video, we can go one level deeper. How to tell the difference between a temporary out-of-practice phase versus a real medical issue. And what to do in the first 30 days to rebuild confidence. If that's something you'd watch, you already know what to do. Subscribe, and I'll see you in the next one.